Good afternoon, everybody. I'm Mike Marshall. I'm the co-founder and executive director of Oregon Recovers, and I'm here to talk to you today about our efforts in the recent Oregon legislature to address Oregon's addiction crisis, address our alcohol crisis, and address really a taxation crisis. Um, by way of introduction, as I said, I'm the co-founder and executive director of Oregon Recovers. I bring over 30 years of experience in the nonprofit advocacy world and political campaigns. I was John Kitzhaber's campaign manager in his last re-election as governor of Oregon. I was involved in the marriage equality work for many years. More importantly, however, I'm 13 years clean and sober. I'm a person in long-term recovery and probably one of my greatest accomplishments. And it's through that lens that I have been brought to this work. The last thing that's not on this slide is I'm also recently a board member of the U.S. Alcohol Policy Alliance, and that's really informed and helped in the work we're doing here in Oregon relative to what is going on across the country. My goal today is just to talk about what just happened here in Oregon. We are probably the tip of the spear in the country, I think, relative to taking on the alcohol industry around pricing as a mechanism for prevention. But also as a mechanism to fund addiction recovery services. So I'm going to talk to you about the facts that mattered and maybe reference some of the ones that seemed to have no impact whatsoever. Talk about our strategy going into this session and then what actually happened. And then, as I like to say, losing forward. It's something we learned in the marriage equality movement for 20 years. We lost and lost until we won. And I just recently celebrated my 3rd wedding anniversary. So what I should say at the outset is that we lost pretty much every piece of legislation we moved forward, and the alcohol industry really pushed back the boundaries on, or pushed back the limits on access to alcohol in a really unprecedented way under the guise of COVID, and with the support and advocacy of a core set of legislators who I would say do not understand how much their advocacy at odds with their core set of values, because it was primarily Democrats and not Republicans, progressive Democrats at that. So we'll talk a little bit about that today as well. In order to sort of understand where we're coming from on this, Oregon Recovers is not an alcohol-related organization. Our mission is to build a new system of care. Oregon has a fractured and incomplete system, and hence we're not delivering the level of services we need to the folks that need them the most. And so we've spent 4 years since our launch in 2017 advocating to build a new continuum of care that recognizes addiction as a chronic condition. Alcohol is a key part of that, as we're going to talk about today. The alcohol industry has been a key part of keeping Oregon from building the system of care that it needs to in an effort to increase their bottom line, as we'll talk about as well. Our theory of change was to build the political will within Oregon to address Oregon's addiction crisis, because addiction is so highly stigmatized, and because there's not been an organized constituency to address it. The alcohol industry has been able to have no opposition in their ongoing efforts to keep alcohol cheap and readily available, despite the fact that we are supposed to be a control state. The second part of our theory of change is to build a political will, but then also build consensus around a plan of action. No one is in charge of addressing Oregon's addiction crisis. And as a consequence, there's no plan of attack. But our theory of change from the very outset 4 years ago was to build the political will, to create a plan, and then address the fact that Oregon has the lowest beer tax in the country, the second lowest wine tax in the country, and that alcohol is the leading contributor to high addiction rates, as well as a whole host of other social problems that Oregon has struggled to address. We're a broad coalition of healthcare companies, treatment providers, recovery centers, but more importantly, of thousands of people in recovery, their friends and family, and then the people that work for the treatment providers and the healthcare companies have a real vested interest in seeing us end Oregon's addiction crisis. We've built quite a broad coalition of over 50 funding organizations and over 2,000 donors. And I'd say close to 5,000 or 6,000 people have participated in our policy roundtables and our events over the years. From the outset, we recognized that we needed to be storytelling, that we needed to bring to legislators, reporters, and the public the facts they needed to know in order to reform the system. And the facts are pretty basic. We have the third highest addiction rate in the country, according to SAMHSA, the federal government. We rank 47th in access to treatment, and previous years it's been 49th or 50th. What people don't recognize is that alcohol kills 6 people a day in Oregon compared to 1 to 2 drug overdoses. That's over 2,000 people a year. That's 7 times the worst year of the AIDS epidemic. And yet nobody has been talking about that fact. And what additionally we need to be cognizant of is that within that addiction rate, we have the 3rd highest addiction rate, but we have the 5th highest level of people addicted just to alcohol in the country. That is significant. It's also a set of facts that prior to Oregon Recovers coming on and telling that story, most policymakers just were not cognizant of. Again, no one in charge at the state level, no one prioritizing solving this problem at the state level, either in the legislature or in the governor's office. This is the most alarming statistics. In the last 20 years, Oregon has moved heaven and earth to build its craft beer industry, its wine industry, now its alcohol industry and cannabis industry. And yet during that same period of time, we saw a dramatic increase, a 34% increase in alcohol-related fatalities. Imagine if any other product caused that level of death, and you can be sure that there'd be a much more robust response. It's the price of all of this that's really, really significant. And that really wasn't recognized either. And the work we did from the outset relative to making sure that the state had a plan of action was to work with the Alcohol and Drug Policy Commission to develop that strategic plan. And in that strategic plan, they laid out that in fact, untreated addiction is costing Oregon $6.7 billion annually. And less than 1% of that money is actually going into prevention. And it's important to recognize that pricing of alcohol is probably the most cost-effective or the most effective prevention measure that's available. And again, we have the lowest beer tax and 2nd lowest wine tax in the country. As a consequence of our advocacy, I want to believe the Oregon Health Authority, prior to the February legislature, looked into this issue as well. And they had Echo Northwest, a very reputable bipartisan legislative or research organization, look at the economic cost of excessive alcohol use, binge drinking. And they came out right at the beginning of the legislative session with a study that was incredibly alarming in that excessive alcohol use. So I think for women, that's more than 3 drinks a day. For men, it's more than 4 drinks a day, perhaps 4 drinks in a certain period of time, which is pretty excessive for those of you who drink. But that the economic toll is $4.8 billion annually. And I should point out here that prior to this study, the alcohol industry claimed that they were a net $2 billion contributor to the Oregon economy. When Oregon Health Authority released this report in February at the start of the legislative session, all of their documentation, their correspondence jumped to say that they were a $12 billion not net, but $12 billion benefit to the economy without any substantive or even identified source for that information. I think what's really important is to look at this and see that over almost half of that is in lost worker productivity. But the other half is in real fixed costs in terms of the direct hit on our healthcare system, the direct hit on our criminal justice system, and the direct hit on our social services system. So this is really, really substantive. And yet not one committee held a hearing on this report during this past legislative session. And I think that's very telling about the culture within the legislature relative to this issue. Sorry about that. Apologies, I'm having some trouble getting my, there we go. Did I skip anything? No, there we go. The other role that we have played, important role we have played, is helping policymakers, legislators, local city council members, county commissioners understand the correlation between Oregon's addiction crisis. Again, we have the third highest untreated addiction rate in the country, and the correlation between our criminal justice system, our homeless problem, and our foster care system, all of which are potent and ongoing political battles in the state relative to figuring out what the solutions are relative to this. But absent actually addressing our addiction crisis, we're not going to have create meaningful change. And I just want to point out that we have the third highest youth incarceration rate. And if you go out and visit McLaren Correctional Facility, where young men in the state are housed, they will tell you that 75% of them were drunk or high when they committed the crime they're incarcerated for. And 75% will tell you they come from intergenerational addiction. In other words, their parents, their grandparents were addicted. And more than 2/3 of Oregon's addiction rate is related to alcohol, whereas meth and opioids are a problem. It always comes back to alcohol. We have the lowest beer and wine taxes in the country. I would say we really don't have beer and wine taxes. The beer tax has not changed since Ronald Reagan was president, not even adjusted for inflation. It's less than a penny a beer. It's like 0.7 cents a beer. Wine is even less, slightly more. But what's I need to point out here is that even though it's 3 cents a glass, 75% of Oregon wineries don't produce enough wine because there's an exemption, produce enough wine to pay the excise tax, because there's an exemption of any winery that produces less than 40,000 barrels a year doesn't have to pay it. And the first 40,000 barrels for those that produce more are tax-free. And spirits are owned and sold by the state, but we have some of the lowest baseline products on the bottom shelf alcohol in the country. We know that pricing as a form of prevention is hugely impactful. Maryland was the last place that actually was successful in raising, as statewide, raising the alcohol tax in a meaningful way. And as a consequence of moving it from 6 to 9%, you saw a 17% reduction in binge drinking, 26% reduction in underage drinking. I'm bringing all these facts forward because I think the facts really speak for themselves. You would think that as a consequence of this information, that here's clearly a solution that legislators would run towards trying to address that $4.8 billion hit annually on the Oregon economy, and the fact that it's really disrupting Oregon families. And yet that was not the experience in this last session. Another argument relative to how the current tax system is harming Oregon is an argument that was made late in the legislative session, but that is against the backdrop of everything that's going on in this country. And that is that by taxing, virtually not taxing our beer and wine and alcohol industry, which are primarily white-owned businesses, but that the net effect of the absence of revenue to build a system of care disproportionately impacts people of color, then there is a strong argument to be made that the current tax structure, whether it was designed to or not, is about protecting the interests of white business owners at the expense of people of color in Oregon. And that's the very definition of systemic racism. So we came at this session after laying the groundwork with creating a strategic plan with the Alcohol and Drug Policy Commission, working for 4 years to try and educate policymakers and the public, but not anticipating COVID and the way it was going to limit the legislative session. We decided to come at this not just head on in terms of talking about pricing as a prevention measure and raising the price in order to reduce harmful consumption and move it into paying for a new system of care, that we needed to approach it from multiple perspectives. And so we introduced several bills. In addition, the primary bill we introduced was the Addiction Crisis Recovery Act, and that was designed to raise the retail price of alcohol 20% so that we could reduce harmful consumption, primarily within binge drinking and underage drinking categories of folks, reduce that by 10%, which would generate over $500 million in new revenue within the tax system that we could then direct towards implementing this new system of care that the state, that we have gotten the state over the last 4 years to design. But we also wanted to make sure that we were taking on the alcohol lobbyists, that we were creating multiple opportunities for legislators to be educated about alcohol. And so we had a bill introduced that would have created a task force to look at requiring that consumers be educated as they buy alcohol, that they're informed about the fact that it's a carcinogen, that it's toxic, and it's highly addictive. Currently, all alcohol is labels about pregnancy, but we wanted to expand that level of education to include the fact that it's a carcinogen and an addictive substance. We introduced a bill to reform the Oregon Liquor Control Commission. Currently, the 7 members pretty much represent exclusively the alcohol industry interests. We had a bill that would require the 2 of them have a public health background with a primary focus in behavioral health. And then lastly, we had a bill that would break up the monopoly that the 13 beer and wine distributors in the state have in an effort to pit the restaurant owners and the small breweries and wineries to pit them against the beer distributors and try and break their coalition. Was not successful in that, but I'll talk about that in a minute. From the outset, we lost the messaging. A 20% increase in the retail price of alcohol was in an effort to reduce harmful consumption by 10%, was basically going to mean that a beer would go from being half a penny to 21 cents. But that's a 2,800% increase. And the other side had all kinds of money and all kinds of communications consultants. They were ready for us. And they had some real allies in the press who weren't very well informed about this issue. Portland Business Journal headline was, the best. It was clickbait online. The article never said that it would take the tax on a single beer from half a penny to 21 cents, which we know from polling is overwhelmingly popular. But legislators only heard that 2,800% number. And so we lost the messaging battle right from the outset. And as a consequence of that, we came up with a compromise very quickly, which we always knew we were going to have to compromise on the amount. But we decided to actually try and compromise on the process. And so to take it out of this COVID legislative session and instead require that there be a task force created by the legislature that included legislators, that included 5 representatives of the alcohol industry, and then all of the state agencies that are involved in the regulation of alcohol, as well as public health, as well as advocates like Oregon Recovers. And we kind of called their bluff because many of the alcohol industry folks were going to their legislators and saying, we know something has to be done. We know the price has to go up, but 2,800% increase is the wrong idea. Again, losing sight of the actual amount. But and there was some significant traction on that as well. But at the end of the day, we lost that, and I'll come back to that. The first bill that fell by the wayside was trying to break up the monopoly that the beer and wine distributors have. They have control over the breweries and wineries in a sense that they control the marketing of their product and the placement of their product in stores. And so if they don't do what the distributors want, the distributors will not market their product effectively. There was no interest in the beer and wine industry for taking on the distributors publicly. And so the sponsor of it said, without their support, we couldn't do it. The second bill that fell by the wayside was the one to actually educate consumers about the dangers of alcohol. You'd think that would be a no-brainer. However, the chair of the committee that was going through said, you guys are going to get your 2 commissioners on the OLCC. They'll do that education. You don't need this bill. So he killed that bill. And then he voted against the OLCC bill, but we still got it to the House floor. It had bipartisan support, but it also had bipartisan opposition on the floor. Many progressive Democrats with breweries and wineries in their districts voted against it. And then it made it to the Senate. No one opposed it. A bunch of organizations across the political spectrum supported it. Great public hearing on it via Zoom, unfortunately. And then one weekend, even though we had all the votes lined up, the sponsor of the bill got news that, in fact, it had been killed, that the beer and wine distributors had turned the arms of several key Democrats in the Senate, and it died just an anonymous death. And it, again, is a reflection of COVID, but also Oregon's 150-year-old system that allows decisions like that to be made in private. The legislative task force thing moved forward, got to Ways and Means, got recommended out of behavioral health, out of the Ways and Means subcommittee. It had the support of the speaker. We'd lined up support in the Senate, but the 2 co-chairs of Ways and Means, one of whom is a doctor, but who takes the most money from the alcohol industry, and the other who doesn't believe in any taxes and therefore did not want to let there be a conversation about taxes, and they killed the bill. Again, I want to stress that the person who killed the bill was the person who takes the most money from the alcohol industry. In 2020, a year before the session, the alcohol industry gave $700,000 to 59 Oregon legislators. And that was what we were up against in advance of this session. So needless to say, all 4 of these bills died different types of deaths, but and as a consequence of 40 years of unprecedented alcohol industry lobbying and largesse in the political system. Not only did they defeat those 4 bills, but it needs to be noted that they were successful in a dramatic expansion of access to alcohol. They made permanent cocktails to go, which is we had been able to defeat in the 2020 legislative session. They gave a tax break to local distilleries that takes money out of the general fund. Well, it's a small amount of money. The notion that we have the 5th highest alcohol use rate in the country and an addiction crisis, and we're giving tax breaks to distilleries, tells you something about the cognizance of legislators of the real issues, the challenges that the state is truly facing. The legislature increased the size of personal wine shipments to people's homes, and now allows beer to be sold at any convenience store that has a beer, wine, liquor license. So that 7-Eleven on your corner can now sell kegs. We truly have abandoned the notion that Oregon is a control state. And literally we did, because the other bill that went through the legislature was to change the name of the Oregon Liquor Control Commission to the Oregon Liquor and Cannabis Commission. They dropped the word control. And I think that is really indicative of policymakers and the power of the OLCC, the current commissioners, the power of the alcohol industry, and the ignorance of policymakers that the OLCC is there to control the sale of alcohol, not to promote the sale of alcohol. And we saw during COVID that they bent over backwards to sell alcohol. We saw in this legislative session that they were very much aligned. The OLCC was very much aligned for the most part. There were some exceptions, but mostly aligned with the alcohol industry. So what did we learn in this session? Well, first off, that COVID really diminished our political power. I said at the outset, our theory of change was about developing the political will and the political power to really create systems change, which includes taking on the alcohol industry. Our power is based on putting people in the front rows of committee hearings, having them walk the halls during a legislative session in t-shirts, doing constituent meetings. And while we could do much of that via Zoom, the power of that was not felt by the legislators. And they, in fact, were making many decisions behind closed doors or behind closed tablets. And so, whereas the established lobbyists for the alcohol industry, after 40 years of political largesse and personal relationships, they had way more power of the session than we did. We clearly did not allocate enough resources for communications and bringing on a strong communications team. We lost the message battle right in the very beginning. That could have been avoided. And so that's a mistake on our part. We need to secure the support of significant stakeholders like the CCOs and the insurance companies and the healthcare companies and the doctors, because they're the ones with a financial stake in seeing the impact of alcohol diminished on families, on people, and on businesses. And they chose not to get into the game. And I think that was in large part because the decisions were being made within their lobbyists and not with their chief financial officers and their CEOs who understand that alcohol is a huge cost driver in their systems. The most profound lesson is that we, with policymakers and reporters, we need to re-educate them as opposed to educate them. They do not understand that alcohol is a toxic, addictive carcinogen that costs the economy $4.8 billion annually. And that's because they have a favorite brew pub and they went to a great wedding at a winery and that's where they go on the weekends. All of these lovely perceptions of these manufacturers of this substance that even in moderation is harmful, but certainly in excessive amounts is causing huge damage. And we have a solution to that that's not going to impact their financial bottom line. But why would they want to raise their taxes if they can continue to pocket as much of their profit as possible? So we need to re-educate our legislators and not just educate them. And lastly, we need campaign finance reform. The fact that the other side gave out $700,000 before the session was clearly why they prevailed in this session. But not all is lost. And in fact, in these sort of David and Goliath efforts, you have to take the long game. My final slide is not moving forward, but we have educated some new legislators and they're really pissed off at the way the alcohol lobbyists acted in this session. We have a whole set of journalists who are much better educated and won't write compelling headlines that are inaccurate because they think they reflect this really positive industry. We know their best arguments. They're thin. They don't have good sound economic arguments relative to the economy of Oregon. And as we bring more facts and data forward, they seem to be seemingly incapable of responding to that or actually agreeing that they're not paying their way in terms of the damage they're doing to the state. We have, as a consequence of this, a much stronger statewide coalition that understands how alcohol impacts the missions of those different organizations. And we've begun to be a part of a national coalition to address the alcohol industry's incredible march forward relative under the guise of COVID to push back access to alcohol, increase access to alcohol rather. And lastly, we did have a win in the legislature in that the sponsor of the legislation, Representative Sanchez, was able to get in the final budget bill a budget note that created a full-time staff person to look at a variety of tax policies, but including alcohol tax policies. And so that's a win in the sense that that work has not been done at the state level for most of the last 40 years. And so it's our responsibility to try and make that happen. That's what we were up against. It's just the beginning. It's not the end by any stretch of the imagination. We're stronger today than we were before. We've learned a lot. But alcohol has to be addressed at every state level. The harm it's causing to our kids, our families, our workplaces is just unprecedented. And we have to begin to, just as they did 40, 50 years ago to take on big tobacco, we have to begin to build a national effort that is state-based that takes on big alcohol. My contact information is here. I would love to hear from anyone who's interested in being a part of this effort here in Oregon or who has criticism of what we've tried or of any of the arguments or facts that I've presented today. I'd love to hear from you. Looking forward to later being on a panel to answer any online questions that people have. So thanks everybody for listening.